I first had this feeling like, oh, what's going to happen when white people read this? I'd spent my whole career dancing around trying to figure out how to say things in the right way, with the right tone, using the right data to convince my peers that what we were up against was so very destructive in the lives of people of color. Exactly how I would say it to you, Stephanie, I'm going to say it in this book. And I did.
Welcome to She Really Gets It, a public health podcast. I'm Stephanie Rhodes, a Black woman, public health professional, and your guide to understanding how policies, institutions, and the systems that uphold them harm the public's health, but also how people are coming together to repair that harm and change the system. Nearly 15 years ago, when I decided to pursue a career in public health, little did I know that the experience of working alongside my white colleagues would end up compromising my health. That leads me to introduce this episode's guest. Her name is Dr. Yanique Redwood. She is a fellow public health professional and author of White Women Cry and Call Me Angry, a Black woman's memoir on racism and philanthropy. As Dr. Redwood details in her book, my experience of race and gender-based discrimination in the field of public health wasn't unique to me. It's systemic, and as we'll discuss in this episode, it's deadly. So, what does it mean when public health institutions and organizations can't and won't make justice and equity a daily practice? What do we do? Where do we go? So, I wanted to hear your perspective on why you wrote this book, because it's one thing to have these experiences. It's another to write a book about it, right? And there's also a level of privilege that comes with to be able to write a book about it as well. So I wanted to know if you could speak to
Yeah,
that.
absolutely. So before that, I want to say that so many Black women have said to me, the title of the book, you can just remove in philanthropy. So it says a Black woman's memoir on racism in philanthropy. Just strike the in philanthropy because it's in academia, it's in government, it's in the private sector, wherever we are and wherever we exert our power, right? That is where we're going to find racism. So I just wanted to say that I've been told to strike in philanthropy from the title of the book. So why I wrote this book, there's so many reasons. I think the things that I will point to are first, I was trying to wrestle with what I had been experiencing. I think for a long time, even as an advocate against structural racism, trying to push back, trying to advance racial equity, I think in some ways I might have, like in the back of my mind, thought, I am exempt from it, right? Like I have some privilege. I was able to get educated in some very, prestigious institutions. I have a PhD. And so maybe like I can fight and have some buffer against the very same systems I was fighting against. And I was very wrong about that, very wrong about those assumptions. And so in 2018, when I was really trying to understand what was happening to me, I started taking writing classes to really like wrestle with my experience. So that was part of it, like trying to understand what have I just been through,
Yeah.
and this depression that I'm feeling and experiencing, is that related to the not only just pushing back against systems which are very harmful, which I you were hurting people and I was just so down about that, but also like it was happening to me. So that was the first thing. The second thing was the way I wrote it. I, for the first time in my career, decided to write without white people as the audience or as the reader, right? So I first had this feeling like, oh, what's going to happen when white people read this? And I had to stop and say, what would it mean to write without that question? Because I had spent my whole career dancing around trying to figure out how to say things in the right way, with the right tone, using the right data to like convince my peers that what we were up against was so very destructive in the lives of people of color. Exactly how I would say it to you, Stephanie, I'm going to say it in this book. And I did. And I think, I don't know for sure, but I think that's part of why it has resonated so deeply with Black women, because I didn't sugarcoat, I didn't dress things up, I didn't try to say it the right way. I just said it how I felt it. And I wanted
Yeah.
to write so that Black women could hear it and see themselves in the story if it was there. I had an assumption that it might be there.
I know the experience of feeling like I need to be palatable to these people, and especially in nonprofits, it's always
Exactly.
about funding and getting the next grant.
And I think honestly, the only reason why I was able to do that is because I was on my way out of a formal career in philanthropy, right? So
Yeah.
I wasn't tied to an institution. I wasn't tied to a job. I wasn't like, okay, I can only say it this way or else my job will be threatened. I had a certain freedom
Yeah.
because I had left a formal career. I had been working for years to make my life smaller so that I wouldn't have to always be moving with the threat of my job over my head. That was the thing that I think over the years it was like, will I have a career? Will I get hired again? And so
Yeah.
once I made some moves to like shrink my life, all the things that we're taught that we need to have, getting rid of those, making everything smaller, then I felt like I had the latitude to move in different ways, to say things that I wanted to say
Yeah.
without the threat of losing my job hanging over me.
You said that, and you mentioned that a lot in the book, thinking about our own privilege. I feel like you brought this up because often, even as Black women, I know I can get caught up in, I'm a Black woman, I have it harder than everyone else. But then I look at, like, I'm a
Right.
trans woman, right? They're often
That's
not
right.
considered to be women at all. I was raised
Mhm.
by a single mom as an African American woman in Mississippi. However, my mother also had a
Mhm.
master's degree in math. Like she, like there was a certain level of privilege to that. She was also a teacher.
Mhm.
There's a certain level of privilege to that. Of I might not have a lot of money, but I'm going to make
Right.
sure you get into a good school. I'm going to do whatever I have to do
Mhm.
to make that happen. And so there is that privilege of like, no, like I am a Black woman, but when I'm working in public health, and I think about why I wanted to work in public health, I have thought about the ways in which white supremacy influenced me to go into that career. Even though I love public health, that white
Mm.
saviorism was always kind of
Interesting.
playing in the background, even though I didn't understand the concept of that at 18 or 21 or 22. Like I heard the term, but I didn't understand the ways in which it had influenced me in my decision to work with certain communities that I felt needed help, as opposed to understanding that these are communities that have been harmed by
Mhm.
society at large, that are under threat by some of the very institutions that
Interesting.
claim they want
Mhm.
to come in
Mhm.
and help.
Interesting.
And so you also talk about the ways in which Black women in particular are let go in nonprofits
Mhm.
and philanthropic organizations. And I did not think you were going to tell this story to the T the way in which you did. And if you don't mind, I want to read the passage because
Sure.
I think our listeners might relate to
Mhm.
this. This is Terry, right? Terry is the vice president of programs at Meyer.
Mhm.
And you say, I had been in the same circles with Terry for years. We matriculated from the same institutions with PhDs in public health, but at different times. She says she is in agony and needs to enlist my support. After the staff meeting, I head to the privacy room to take her call. Terry is bawling. I can't even understand what she is saying. I try to calm her down, but it's not working. I make out that she has been fired after 20 months at Meyer and she doesn't know why. She has been given a week to sign an agreement outlining her severance pay and is expected to refrain from disparaging the foundation upon signing it. Beyond the why of her firing, she is devastated about the how. She tells me that she was summoned to Nikki's office, and when she walked in, Nikki and Myers' HR consultant were waiting. She says she had no frame of reference for the scene unfolding in front of her. She says they explained that she was being let go, and the HR consultant followed her to her office to pick up her purse and briefcase before escorting her out and taking her key card and file cabinet key.
Yeah, yeah, yeah. Um, when is this? So this was last year, 2024, at the top of 2024. Dr. Claudine Gay came out and said that she was resigning. So we knew it was a forced resignation. Um, and just a couple of weeks, I think, a same month. I don't know if you remember the woman, gosh, I'm forgetting her name right now, who killed herself after experiencing workplace abuse. It was in the same month.
Yes.
And so I was so struck by both of those, and I reached out on LinkedIn. I said, you know, are there are you Black? Have you experienced workplace racial abuse? Like, just send me a message on LinkedIn. I just want to know how many of you are out there. And it just was rolling in all these women. And I think it was within a week or so, I had about 100 stories. Because as people were reaching out, I was like, I need to create a way to capture these stories. So I created a very, very informal survey. And the stories, Stephanie, the stories of like the process of being fired after, for example, complaining about some sort of discrimination in the workplace,
Yep.
after coming in to fix problems, serious problems, right? Actually fixing them,
Yeah.
doing the actual work,
Yeah.
and then being laid off, then being fired, actually, or forced to resign. So many stories. And then the impacts, right? Like the levels of like physical illness following that
Yeah.
moment, right? Women talking about their blood pressure going up, talking about breaking out in hives, can't sleep, then into the kind of mental health issues, thinking about self harm, actually self harming. I mean, the impacts were so devastating.
Yeah.
And it's so very real. And any women who have read my book or who responded to that survey actually believed that they were doing something wrong, that something was wrong with them. Oh, I thought that maybe I was like crazy, or I thought that maybe I was, taking it out of proportion, or, all of
Yeah.
this, like the effort, the effort to exist in these spaces. And then when you experience what you know you're experiencing, to then be like doubting yourself, not sure, it is, it is stunning.
Yeah.
It is stunning.
You mentioned in your book that communities at the margins, and I'm going to pull a direct quote here. Communities at the margins need to be at the center of their change efforts. They have the most to gain if and when the change they seek comes, and the most to lose if it doesn't. Someone with class privilege like me should never be at the center of their change efforts. And you were specifically talking about,
Mhm.
I know, community-based participatory research, which is a form of research that's very common in public health, and where communities and researchers work together and they identify challenges and supposedly design solutions and outcomes or measure outcomes. But that dynamic is always present of you have this very privileged person
Mhm.
often leading the research and dictating the direction of it and also deciding what is a good outcome, like what is a positive outcome. It's very rare that I see where communities truly are designing and making those decisions. I hear that term
Mhm.
community-based participatory research, but it seems to vary case by case, right?
Mhm.
Institution
Yep.
by institution, researcher by researcher. So, why is that? Why has there not been like a formal decision on what counts as community based participatory research that is always going to allow the communities themselves to decide what a positive outcome is?
I mentioned a story. It was kind of hard because to include it because I loved where I went to school. But it was the moment when I was in class and we were talking about a CBPR, Community-Based Participatory Research Initiative. So it was about a relationship between a university and a community. And, me with my, kind of naive self, I think at this point I am about, gosh, 21 maybe. And I asked, well, why can't the university just turn over the the CBPR effort and all the money that's coming to it to the community? And my professor was just like, well, she starts talking about indirect costs and all of this. And I was like, oh, right. So this is owned by the university, right? The money comes to the university, and then the university takes some of that to pay all the overhead costs. And then the rest of it goes to paying salaries and things like that, and then to the community. And that dynamic, as long as it's in place, as long as the money is going to the university and then going to the community, then you will have this dynamic where CBPR is practiced not as close to how we imagine that it is being practiced. Because unfortunately, given the society that we live in a capitalist society. You have control of the money, you have the power, right? And that's what this is about. It's about differential power and access to those resources to make your own decisions for your own community. And I haven't seen much of that either. I mean, when I was doing CBPR, the money came to the university. I was the project director. I was the one who was hiring community folks. I tried to do certain things. Like, for example, I remember saying, hey, wait a second, I have health insurance. Why don't the community members on our team have health insurance? Oh, well, because they're contractors. Well, we can change that. Why can't we change that? And so worked to get them hired by the university so that they could have health insurance. But those are still, they're ad hoc. They're, like you said, it was me pushing, and then, having a couple of the community members had a background. And so the university was like, well, we can't hire that person. Yes, you can. Me and my PI, we were like, you can make exceptions for this. And so we pushed for that. But it was about pushing. It wasn't in place. You know what I mean? And so that's why I think it's going to be ad hoc. Because of those power differentials.
Yeah, and what the crazy thing is, okay, so I think about just how hierarchies work, how racial hierarchies work, gender hierarchies work. When Black women do things that help ourselves, it automatically helps everyone else, right? When we improve life for Black women, we improve it for everyone else, right? When the standard becomes you have to ensure that Black women are not dying in these hospitals, and we're going to make sure that Black women aren't dying in these hospitals. I don't care how I've got to change this system. I don't care what changes we have to do. We have to build our own clinics. It becomes the standard. It becomes the standard. That's,
I mean, the thing is, I spent so many years pushing back on systems and trying to convince and talking to people and going to council members and, going to other CEOs and trying to convince. And I said, at the end of all of that, when I was burned out, I was like, okay, I have not been taking care of myself. And so I need to first do that work of reorienting my relationship to work, right? Which was what I said earlier about getting smaller. So when I get smaller, I don't have to work as much. And so I need to reorient my relationship to work and make my relationship to productivity. I needed to slash that. I just needed to stop doing that. And then trying to create spaces for Black women to do some of their own work around, always trying to push against systems and save the country. And, I would just like to see what it would be like if we just didn't do that work.
Yeah.
I know we're afraid that, oh, well, if we don't do it, then the whole thing will fall apart. Well, maybe it does need to fall apart. You
Yeah.
know what I mean? Like I just because we keep doing the labor of at least making it sort of better for people and without much in return. And so I'm just at a crossroads right now where I'm trying to figure out how we build our own spaces, our own communities, how we do it from a diasporic, is that a
Yeah.
word? How we think about people across the globe, women across the globe. So I'm in, relationships, for example, and these are fairly new relationships. There's a woman I just got off the phone with this morning. She's in Morocco. And then one of my good friends and colleagues, she moved back to Senegal after saying, enough, I can't do the United States anymore.
Yeah.
We've got relationships with people who have moved to Mexico. Like, how do we think beyond the US as
Yes.
our center of gravity for
Yeah.
change? And how do we think globally
You know what? So
relationships?
one of my colleagues said this because we had this conversation about like, whether to stay in the United States, whether to leave the United States. And of course, there's a lot of privilege in being able to leave the United States, right? So I didn't realize until
Hmm.
I decided to
Hmm.
leave the United States. Oh, I need to have $10,000 in my bank account in order to qualify for this visa. And I have to get I have to get a tax ID. I've got to do all of this stuff to build this new life. Of course, once I get there, I don't have to worry about paying $600 a month for health insurance anymore as a self-employed person. I don't have to have a credit score of any kind to get an apartment. There are all these other things that I don't have to worry about. And what's the balance here? How do I start to get more work? What is my work going to, what if I don't get any more US contracts? How do I build a new
Hmm.
network and new types of work that I would want to do, right? What does that look like? So all of a sudden I have to become more expansive with what I think is possible, which can be scary in the US when you're working all the time. Of course, I think all the racism and sexism I dealt with as a Black woman meant that I ended up doing more consulting. I didn't have the
Hmm.
luxury of like having these safe, secure positions because if you're a Black woman who doesn't want to give yourself ulcers trying to put up with nonsense, racist nonsense, sexist nonsense, misogynoir in the workplace, you won't last too long at
Hmm.
most organizations. Like my great
Right.
great grandfather was a slave in the state of Mississippi until he was around 6 or 7 years old. And well, I mean, he's long dead now, but he raised my mother, right? It's not that far. It actually
Right.
isn't that long ago. like,
Right.
like he was an old
That's right.
man co-parenting her, but he was alive when she was alive. My mother's in her 70s now. She's in
Hmm.
her mid
Hmm.
70s, right? She was born,
Hmm.
yeah, the late 40s. We weren't here by choice. So what can we do that's by choice, right? How do
Right.
we start to look in the
That's
direction
right.
of like, if I had to choose anywhere in the world that I wanted to be
Right.
based on like just access to healthcare, cost of living, safety,
Right.
safety from violence, safety from gun violence. If I had to really think about
Mhm.
it, is this what I would choose? Because none of that was by choice.
Right. Exactly. Right. And there was no promise of, okay, well, if you build this, then we will share it with you. There's no promise of
Nothing.
that. And so I wrote a second book last year with my husband called We Quit America, and it's about our decision to spend more time outside of the US than inside. And yes, there is some privilege that might allow certain people to do that. We have seen people with much less privilege do it too. But we wonder if we thought communally, then we might be building communities and creating spaces so that others who have less privilege can also come. And so it's not an individual choice, although it can be, but we're hoping there are more people thinking communally about what it would mean to build healthy, safe places in the diaspora for people who are willing to take some risks to come. And, part of why we left or why we are spending so much time outside the US is because of health. We believe that if we were to stay in the United States, not only believe, it's backed by data. We are not going to be as healthy. We are going to be sicker and die
Yeah.
earlier. And we would like a longer life, you know? And so we are saying we think we can be healthier in other settings. And we've met so many people we interviewed for our book who made the decision to leave the United States for health reasons in order to be healthier. And so if it's done at scale, that's a public health movement. That is a public health
It
movement
is.
if done at that
Yeah.
idea.
So when you dream of building your ideal Black community, what do you dream of? And what would it
Mhm.
include? And like,
Mhm.
what does that look like for you?
Yeah, I mean, I actually don't have to dream it. I experienced it. I went to Mexico, to Playa del Carmen in December because we interviewed so many people in Playa del Carmen for the book, for We Quit America. And they just spoke the way they talked about it. I was like, we got to go and see what's going on in Playa del Carmen. So we went to visit, and to see Black folks, Black people from America who have left, rebuilding in this place. I mean, the levels of community coming together, entrepreneurship. There's one Black woman there who started a food truck and then created a food truck night. So I think there are now like 6 or 7 food trucks every Thursday. People come out, the kids are there, people are like playing games. Um, there's like a long like walkway area, people walking for their health. I mean, to see Black people self-determine that there is another way for us to be healthy and to have community and to feel safe and to take the risk to do that. And we've always done that. That's what the Great Migration was about, right? I also learned recently that there were Black people who were enslaved who went south to
Mm.
freedom, right? So there are many that went north, but there are people who went to Mexico because Mexico at the time um, had a Black president, Black and
Oh,
Mexican
wow.
president, who had abolished slavery in Mexico and said, if you come here, if you're enslaved and you come here, you have your freedom. So Black people in New Orleans, in Texas, went south to
Okay.
freedom. This is what we do. We pursue our freedom
Yes.
and we take the risk to do that. And we have the imagination and the skills and the spirit of community to take care of ourselves. And so that's that. I saw it with my own eyes in Mexico, and that is the kind of spirit that I would want in these communities across the diaspora. So if it's happening in Lisbon, I want to know about it, and I want to tell others about it. Um, you know, People ask, well, or say, well, Jamaica, I don't know if Jamaica is the place for me. It doesn't have to be the
Yeah.
place for you. It's the place for me. But there are so many other places where people are saying we can rebuild.
Yeah.
And I think especially when we do it so that we can be safe and healthy. I mean, I just love us.
I was telling my mom that my
Love
mom
us.
is in Mississippi, where there's like a water
Mm-hmm.
crisis, very similar to Flint's water crisis. You look at Jackson, Mississippi,
Mm-hmm.
like
To
it's
Flint.
like there's not the water is not safe. Okay, it's not. And so my
Mm-hmm.
mom has
Mm-hmm.
gotten so
Yeah.
used to it that she's just like, oh, it's not. You can
Mm-hmm.
brush your teeth with it. And I'm like, Mom, no, absolutely not. Like, let me put some. I'm putting filters on your sinks, and I'm adding filters to the showers because absolutely not.
What are the other ways that we can live? Are there ways that, one of the things that we tried at one point, it was 3 generations in one house. It was my mom, it was me and my child, my sister and her children. Like, what are the other ways that we can push back against these narratives about what it takes to live a good life in the United States? Ways that are especially for Black people, all the overwork is really not healthy,
Oh
is
yeah.
killing us. And so just asking people to reconsider, to really interrogate these systems and decide for yourself, what does it take to live a healthy, safe life, and follow that vision and that
Yeah.
path.
I'm
Yes.
glad that, yeah, honestly, I'm so glad that we actually got to this topic just because I think it's one of those things where, like, my mom thinks I'm crazy. I think she's come to, I think this past year, I think this last election, she was like, okay, maybe you were onto something. Okay. I was like, yeah,
Right,
yeah.
right,
I
right,
was like,
right.
so I
I
think
mean,
2025, she kind of changed her tune a little bit.
I think our mothers are the same age. And my mom, when we started talking about like getting a place overseas, she thought, what is going on with my daughter? But she lives here. She lives here with me, and
Really?
absolutely loves it. Absolutely loves it. And whenever she has to leave to go back to the States for whatever reason to visit the grandkids or whatever, oh, she's throwing a tantrum. She just loves it. And so your mom may come along. She may come along. And, a lot of people don't want to take the risk because they don't want to leave family behind. But sometimes you make a move and people start coming. They start moving too. But we walk around blaming ourselves for not being able to do what the narratives suggest or say that we should be doing, right? Long time ago, I started a business and it failed. It was a magazine. It failed miserably. And I was so hard on myself. I've been reading Inc. magazine, some of these entrepreneur magazines, and I went to see a coach, a career coach, a Black woman, and she was like, "So tell me about the people in your magazine that you're reading. Who are you? Whose stories are you reading?" And I sat there. I was like, "Oh, everybody in these magazines, mostly white men." So I'm comparing my little business that failed to white men in these magazines who are given chance after chance after chance to fail and try again with large sums of money, right? Like I was using my little credit card to start this little business. The other day, I was on my patio here, my veranda here, and I saw flames in the sky, only to find out that another one of Elon Musk's rockets has exploded, right? And that's what I'm seeing looking out. It's like you just try and fail, and doesn't matter how much money and is invested, and I'm using my little credit card, $10,000 to try to start something.
I was thinking about what you talked about, like, in your book as well. Just, I was thinking about, like, your work, your ill your when you got sick, because a
Mm-hmm.
lot of us have gotten physically
Mm-hmm.
ill
Mm-hmm.
from what was happening on our jobs, like, and I think
Mm-hmm.
about, Black women and autoimmune diseases, and I've always said that in grad school. I was like, well, autoimmune disease is your body attacking itself, right? So when you're under constant threat in the workplace, under, racist microaggressions, and you feel you can't speak up because you fear losing a job, so you fear homelessness, and you're walking around with that fear all day, your body's going to respond the way bodies respond to threat. And I think so many Black women right now are walking around these very toxic, white dominated spaces, these increasingly hostile environments, especially with the current administration. It's having a direct impact on their health.
Mm-hmm.
How did you get back to healthy, and what would you like to
Mm.
tell other Black women who are struggling right now?
First, my board at the time, I had asked for, I think, a couple of weeks off. Like, okay, we're going on a holiday, December holiday. Can I just have a couple of weeks off? I'm really exhausted. And it was a Black woman on the board who said, "You know what? Is there any reason you have to come back before February? Like, what's the rush?" So that was one thing. So me taking extended time off, because I could, right? I could. Um, the next thing I think for me to get back to health was happened with my therapist. We were, having a session. I think I was talking about white women again and what was happening at work, and she asked me this question that when I look back at it, I just remember thinking, why are we talking about this? And she was like, what do you do for pleasure? I was like, I take vacation every year. And she was like, no, 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 I'm not talking about once a year or twice a year, whatever, going away vacation for a week or two. I want to know what you do every day to please yourself. And I had zero answer for her. I had no answer for her because I was not in that practice.
Yeah.
And so she had me begin once a week to do something because it felt good. And I remember asking her, I said, do you mean like a project? Because I was thinking, oh, well, maybe I could start a garden or maybe, like some like
Yeah.
project. And she was like, no, not a project, but just anything that feels good to you. And that was the beginning of my journey back to health because I had no idea how to center feeling good in my life.
Yeah.
And so, just little by little, it was very painful, but little by little, I just started to think about what pleases me. And
Yeah.
so, I just remember starting to be very pleased by the sky, by the moon, by the stars.
Hmm.
I'd never had that relationship. I'd never looked up really. And so
Okay.
then I was like, oh, maybe I could get a pair of binoculars. And I got
Yeah.
a pair of binoculars. Just really small experiments. And since then, I was about 2018.
Okay.
And now reaching to a point where I can't think of going a day without something that is pleasing to me. And that
Okay.
can be small. It's like even right now talking to you, I feel the wind against my skin. I can see the leaves on the trees. I just love that movement. I can hear the wind through the leaves. It is one of the most pleasing things that I've ever experienced. And that was by centering pleasure, I was able to make decisions to prioritize what feels good to me and therefore my health. I'm not in the United States a lot. And so I think that has also contributed to
Yeah.
my health. December, I hosted an art exhibit with some images from the film that is coming out based on my book. And one of the sections of the art exhibit is on weathering. It's on how Black women's bodies are
Okay.
breaking down as a result
Yes.
of racism related stress. And I asked women in that section of the exhibit, there was a full length mirror. Stop by this mirror and take a good look at yourself and just identify where in your body do you think weathering is living or lingering. And there were just so many stories of pain, joint pain, rashes, unexplained symptoms, going to the doctor, getting all these tests. There's nothing like medical there, but that stress, that constant activation, constantly
Yes.
worried, constantly trying to be safe. The body is inflamed. It can't calm down. The cortisol levels can't come down. And that is what is happening to our
Yeah.
bodies. And so I think first just acknowledging and recognizing like we're living with all of this stress that we are coping with. We're, disembodied. We're compartmentalizing in order to make it happen. I think just raising that awareness. And then I do believe that pleasure is an important pathway for us to like reclaim what we deserve and to reclaim our health and to reclaim like just centering ourselves in our own lives. And so that's the conversation I'm having. It's hard, I think, if you are still in the rat race. I think it's easier if you allow yourself to get out of that rat race, but I still think it's possible. It
Yeah.
started for me while I was in the US. It's not like I moved to Jamaica and then I started working on my health and my wellness. I started this process in the United States, and I think pleasure is a way to begin that journey.
If you would like to get into contact with Yanique or book a virtual discussion of her book, White Women Cry and Call Me Angry, you can do so at hereToHelp@whitewomencry.com. The book is also available for purchase at www.whitewomencry.com. I'll put links for all of her contacts in the show notes. And if you enjoyed this episode of She Really Gets It, please review and rate this podcast via Apple, Spotify, or wherever else you get your podcasts. It really helps people find the show. If you have any topics you believe we should explore in future episodes, you can join my Substack and reply to any of the emails I send out. Links to that will also be in the show notes.